Hello, thank you so much for staying here on the AM show. And you just heard my colleague Benjamin Akapo speak to presidential hopeful Mr. Akpalu. But it's now time to talk about your health. And for the past few days, we've been talking to you about a vaccination program by the Ghana Health Service because COVID still remains a threat, even though it's no longer a pandemic. And even though we've seen a decrease in the number of cases, there's still a concern, especially because a recent WHO report showed that even though there was a decrease in reported cases in Africa, there was an increase in the number of deaths. So it's important that we stay safe, we keep to the protocols and get our vaccinations. This morning, I've been joined by Dr. Amponsa Achianu. He's Programs Manager, Expanded Program on Immunization at the Ghana Health Service. And he's joining us for a conversation because there is a campaign by the Ghana Health Service to ensure that at least they're able to get most of us in Ghana vaccinated. Hello. Good morning to you,
Good
Doc.
morning, Benny.
It's good to meet you.
Good to meet
in
you.
person, finally.
Sure.
Briefly tell us what the situation is like when it comes to our figures now and COVID.
Thank you very much and good morning to your cherished viewers and listeners alike. So, if I have to say anything in one sentence, I would say that number of cases of COVID have been reducing. So we've been seeing decreasing number of cases. However, the pandemic is not yet over. For us in Ghana, I would say that our caseload is very low. We have only one active case.
Okay, as we speak.
Yes, as we speak now. And generally for all the other regions, apart from Greater Accra, there's virtually no case.
Right. So then why is it important for us to get vaccinated? Because then, I mean, we are okay. Why do you still want to get us vaccinated?
Yeah, but we've been here before, you remember? Right. When there was no case or very few cases, and then suddenly we had a spike.
Yeah.
But suffice to say that on the 5th of May, the WHO de-escalated COVID as no longer a public health emergency of international concern. Unfortunately, people misconstrue that as the end of the pandemic.
Okay.
That is not the case.
Okay.
The case is that we are moving from the emergency phase to a more relaxed, as it were, integrated manner, where COVID is part of us and we need to deal with it as such. So it's not as if the pandemic is over, it's not yet over. It is the emergency phase of it. Of course, we can't remain perpetually in emergency, we need to live our lives.
Yeah.
And so once immunity is going up, people have been vaccinated, some have had infections. You know, there are two ways of getting immunity. You either get infection or you get vaccinated. If you are not lucky, you get infection, you die.
Okay.
Yes.
Yeah.
So,
and that's what we are trying to prevent.
Exactly.
Okay.
A lot of people have had immunity go up, and therefore would say that the cases are reducing as a result. But that is not the end of the pandemic.
I made reference to a recent WHO report. Even though we don't have specific statistics about Ghana, our region, which is Africa, is, cited in the report for having a decrease in the number of cases, but an increase in deaths. Do we understand why that is happening at all?
Well, I don't have any major understanding of that.
Right.
Nobody has done any studies to suggest any clue to anything.
Right.
But the point is that this virus is very, very treacherous. It can easily change its form, what the scientists will call mutation. So you can never predict it. And therefore we need to gird our loins and make sure that we are protected and we are not taken by storm.
Yeah, that was one of the things about the COVID virus that got a lot of people disturbed because of the mutations, the variants, and there were even concerns when vaccines were produced whether they could deal with all the emergent variants and all that. Yeah. These vaccines we are going to get. I know we have used the Johnson & Johnson, we have used the Pfizer, And did we ever use Moderna?
Yes, we did.
We did use Moderna.
We even used Sputnik V.
Sputnik V, yes, you're right.
And AstraZeneca.
And AstraZeneca. So this vaccination exercise we're embarking on, what would it look like, especially for those who are yet to receive their booster shots? Do they need to be concerned about whether they're going to get the same dose of the same type of vaccine, or we can do a mix and merge? I just want us to educate people on what they should expect when they walk to a center to get vaccinated, or when a health official approaches them to get vaccinated.
So, responding to your question specifically, for boosters, we do not mind whichever vaccine you take.
Okay.
By our policy, for a booster, you can take any of the vaccines, irrespective of what you took for your, what we call the primary series. In other words, the very first doses you took.
Right.
Yeah. So for boosters, there's no problem. What we have, in fact, there's no new vaccine. It is what we had already. For now, what we have in the system is Johnson & Johnson, which is one shot. And that is what we are using.
Okay.
It is for persons 18 years and above. You will recall that for us, the policy is 15-year-olds and above being vaccinated. However, we don't have the vaccine for them now. We are still working to get additional vaccines. So what we have is what we have had previously, and it's the same vaccine we are using.
I remember the point there was a lot of apathy and hesitation. People were skeptical because there were all these myths around about it being a certain, way of controlling humans. Eventually, there's some chips in there. People even put their phones to the site where they were injected, and they say the phones got stacked. There was something magnetic, and so people were like, "Look, I mean, we don't want to be a part of this new world order, which is trying to influence and all the theories,
yeah,
right?
Of course,
and usher in the post-rapture world, and
everything religious,
yes,
whatever,
right?
The misinformation, disinformation, but the case speaks for itself.
Right. So I can imagine how challenging it will be for you now that the figures are pointing to a reduction, and trying to convince people that it's still important that you get the shot. We had a target. Do we know how far we've gone in reach? Was it 20 million?
Yes.
How?
Actually, specifically around 18 point something, but it was rounded up to
20 million.
Yeah.
So what percentage of that target have we vaccinated or covered?
Interestingly, we've done about 76% of that target, yes.
That's impressive.
You have almost 14 million persons ever coming for a vaccine. 14 million, that's a whopping large number. Among them, about 11 million are fully vaccinated. In quotes, they've received the primary series. So we still have around 3 million persons who are yet to get an initial dose.
To complete, okay.
Yes, and then if you subtract the 14 from the 18 plus, you have over 4 million who have never received a vaccine. And so that's the statistics. We've done a lot, but we still need to push hard. But the issue about vaccine is that you normally give a vaccine when the disease is not there.
It's better that way.
Yes, because that's the nature of a vaccine is preventive.
Okay.
And so it's when you don't see the disease, that is when you need to actually give vaccination.
Right.
If you look for the kits, for example, yellow fever, measles, BCG, you don't see them because we continuously give the vaccine.
Right.
Anytime you withdraw the vaccines, the diseases will come back. And so a vaccine is not curative. And that is why when I get a question, you don't see the disease, why are you vaccinated? That's the essence of it. The vaccine is preventive.
Right. But have we achieved herd immunity? Are we close to that?
Not yet. In fact, nobody really knows the threshold for health, for herd immunity or community immunity, as we call it. But the principle is to get as many persons who are eligible as possible to get vaccinated. And the more you do that, the better it is for the rest who, for one reason or the other, may not be vaccinated. So either because of some circumstances or the other one issue or the other, they may not be able to vaccinate. And so that is the reason you don't need to get 100% coverage.
Okay.
Yes.
Okay. Yeah. Okay. So this is happening from the 19th to the 23rd of July. Right.
We started 2 days ago.
You started 2 days ago.
So we are completing this exercise on Sunday, but that's just a period set aside to drum home, to make a bit of noise, mobilize society. Beyond that, we'll still vaccinate.
So it doesn't end. That's what I wanted to come to. So this is just a campaign, right? So we're just trying to mop up and mobilize as many people. And, you know, because we are quite a busy people, sometimes people like you to bring it to them. And so these are some of the exercises that you have to embark on.
Look, this is the 7th one we are doing.
Yes.
And any time we do that, people take, in fact, there's a spike always. And the data speaks for itself.
Okay. So 23rd of July is Sunday.
Yes.
Where can people go to? What should they look out for?
So our healthcare workers will be moving to churches and mosques, places where you can find human beings, as it were, market areas, lorry parks. Some will go over banks and sleep on the islands, and all the places that we normally do childhood vaccination. This is adult, so we are just replicating that for the adults. But again, beyond that, the whole world is trying to make COVID vaccines part of routine. So that's the next stage, because now it's de-escalated and it's no longer a public health emergency of international concern. It's going to be part of the routine, so that routinely when adults who are at risk, there are 3 risk groups. You have the high risk, the medium, the low. They can walk in anytime and take their vaccine.
How many booster shots can one take?
Well, for now, I would say that if we go by the risk groups, then we would think that if you are high risk, like healthcare workers, persons with underlying conditions who are also old, and especially the older adults, they will need a booster after about every 6 months to one year.
So in other words, you are prepping us to
1 or 2.
Take this as a lifestyle, really.
Not necessarily. Maybe up to about 2 years, 2025, we may have to give boosters to especially those who are most at risk.
Right. I see the challenge for many people is that we are not used in this part of the world to older people taking vaccinations on the regular. In other parts of the world, when the flu season is coming, people go for their flu shots and all that. But here, it's not like that. We see the children getting their vaccinations. So I think that's where the struggle is.
Yeah, so it's going to be like the flu shot, but not perpetually as is happening in the temperate areas. For this, it's maybe a year or 2.
We're still learning a lot about the virus, interestingly. Are there new variants emerging?
Well, new variants keep on coming up, but these are not variants that are too different from the original, the Omicron variant.
Right. So this morning, I'm speaking to Dr. Amponsa Achianu, Programs Manager at the Expanded Program on Immunization for the Ghana Health Service. And he's here to talk to us about their National COVID Vaccination Program. And it is the 7th one. And it's all because, yes, the numbers are reducing. Yes, the WHO has de-escalated, or how do you put it? Declassified the whole disease as an emergency.
Yes,
and so it still exists. You need to protect yourself, especially if you fall within a vulnerable group. It's just important that you take responsibility for yourself. So how do people contact you? I know that you're all around the country, but if somebody says, for example, I have an office, you haven't visited us, I think you should come in and try and take care of everybody here. Are there opportunities like that for people to contact the Ghana Health Service?
Sure, there are surely opportunities like that. Of course, you don't expect people to be moving from house to house, vaccinating individuals, as it were, because it's a very difficult task when it comes to injectable vaccines. If it's oral, it's easy.
Yeah.
But for an injectable, you need a nice place, maybe under a shade, where you can put 1 or 2 things together, and then also dispose your waste properly. If you are moving from house to house, I know some healthcare workers have tried to do that, but it's exceedingly difficult. And so if it's a workplace, that is easier, where you have people gathered.
Large groupings.
Correct.
Yeah.
That can be arranged. And in fact, that is what many of the districts have been doing. They arrange with the people and then move as and when it is necessary.
Doc, let's talk about side effects, because it's something that interests people a lot. We've read articles, we've seen concerns about blood clotting issues. And I know that for healthcare workers, you're always careful when it comes to issues like this. But we can't deny the fact that there are reported cases of suspected, issues as a result of people taking the jabs and all. How do you address that? What should people do? Is it true that if I get a COVID vaccine and I begin to feel sick, it's probably because I may have a certain disease that's lurking, that hasn't, gone full-blown, and the vaccine is not necessarily causing me to be sick, but it's just exposing that? Just help us address, because there's so many things that we hear.
Yeah. So, yes, the issue of adverse events is very tricky. Of course, we communicate that a lot. The one thing about vaccines is that you get a vaccine, or anybody gets a vaccine, anything happens after that, and it's the vaccine. And in fact, almost invariably, that is not the case. However, we know that vaccines themselves have inherent properties that can also cause side effects, like fever, maybe vomiting, and so on. So we have some side effects that are due to the vaccine. Others are just coincidental.
So what do we do? It's one of the reasons people say that they don't want to go for the vaccine because they don't want to be left with the side effects. So what has the study shown over the time? Are these side effects mild or,
Yeah, for every vaccine. In fact, the COVID vaccine side effects have not been too different from the side effects of other vaccines we know. Otherwise, we would have stopped them long time ago, because it's always risks against benefits, or benefits risks. So normally for vaccine, if the benefits far outweigh the risk, then of course you manage the risks. If the risks are over and above that of the benefit, of course the vaccine is then withdrawn.
But what is the data
for us, the data shows that there's no cause for concern in terms of the COVID vaccines as of now. And interestingly, COVID vaccine is the most vaccine, I would say the vaccine that has been given most in the whole world. Over 13 billion doses given, over 5 billion persons have been vaccinated. Which experiment is more than this? So if there's really a problem, I'm sure the whole world would have seen it, and then the vaccines would have been withdrawn. But as of now, working with international community, working with our local community, and of course the regulators, we haven't seen anything extraordinary.
The issue about people who have gotten initial doses and coming for booster jabs and all the concerns around that, that's why you created the card, because it has all the records in there. But we know the kind of society we live in. People have been affected by floods. People have, been robbed. They can't find their cards. I know somebody who went and said, look, I've taken jabs already. I can't remember which brand it was, but I want to retrieve the data. And they're told, we can't. We can help you. He went to the center, type in my name, try and get me just the data, so that, because I moved from Kumasi to Accra. So I just need to do my booster jabs, and I need that to help me. But the cards don't seem to be working as we expect.
We have levels of, levels where you can do that. You can lodge a complaint.
Okay.
First of all, if your card gets missing, you see, the card replacement of the card is not as simple as that. It's like you replace a passport and you say, give me another one. It's not. You need to have a proof that your card is truly missing. Okay. And so what we advise people to do, if you are burgled, for example, report to the police, let the police give you a report. And then you send it to either the district. If the district cannot help you, they direct you to the region. At West, then you come to the national. And we've been helping people, especially travelers, on that.
You're able to help them?
Yes, we're able to do that.
Okay. So you've just heard it here. If you're struggling, if you have issues, just reach out to the Ghana Health Service at your district level, and then they can escalate it if they cannot help you. But talking about the cards, we still don't need them to travel, do we?
For now, for Ghana, probably not. But if you are going out, you need to find out from your destination country. Right. Because I was in Togo last week, and I tell you, there's a rigor. You need to produce your card.
Oh, wow.
Yes. So eventually, maybe countries may also de-escalate that. But for now, you need to keep your card.
All right, so please keep your card. And I know somebody who was compelled to get a dose because they had to travel. Not necessarily because they wanted to get it, but they have to satisfy the requirements of the country they are visiting.
Maybe we can interrogate that. So which was more important to that person? Is it the travel or the vaccine? Isn't it?
Yeah.
Interesting?
And Doc, once you're bringing that, let's just let people know there are required times between the shots.
Yep.
So I know of people who've literally had to beg because their travel time is closed and the health official says, I can't give you the dose today and give you the second dose in 2 or 3 weeks. I need to wait for the required time.
Okay.
But the people are bent on traveling at the time
so
they have to.
They insist on that.
And they insist on that, and it's usually a struggle
Let me explain. Maybe we need to re-educate our people. You see, giving vaccines at short intervals do not really cause any problem.
Okay.
The issue is the benefit. You may not benefit. So one of the doses will be counted as null and void. That's the only issue. But if the person insists, if he's an adult and he insists, you can give it. There's no problem.
Right. There's no problem?
No.
If I take a first
But
shot?
the minimum interval, usually for many of the vaccines, is 4 weeks. But there are also some vaccines we give at 3 weeks interval.
Okay.
So it's not an issue.
Okay. Right. Or maybe just to save yourself all the hassle, just get your shots, be relaxed, get your card whenever you have to travel. You just.
But I understand that sometimes, it's an unexpected thing.
Yes.
So if you come today and you come the following, let's say, 3 weeks after, for many of the vaccines we can give. Moderna, for example, 21 days, you can give. We have tried to standardize a lot of the things so that you take them at maybe a minimum of 4 weeks interval. There are some that you need a minimum of, say, 8 weeks interval. But, because it will bring a lot of confusion, we try to standardize, looking at the benefits and the risks. And that is why some of these issues, especially, I'm talking specifically with COVID, that's why some of these issues around confusion come.
Let's take some of the boxes. Can pregnant women take the vaccine?
Yes, they can.
But
they have their vaccine.
Okay. So you need to declare if you're pregnant and it's not visible.
Yes. In fact, they are part of I'll say the medium risk now, as the new guidelines suggest. They are part of the medium risk.
Okay.
And more so, infants, that is, infants below 6 months are more at risk than even children 6 months to 17.
But we don't have vaccines for them yet.
No, we do, but we in Ghana do not give it. Based on our data, we don't give it to persons below 15.
Okay.
Yes.
All right.
But many countries do as low as 6 months, especially the US.
All right.
But the point is, pregnant women can take the vaccine, but not what we have now.
Okay.
You remember I said they have their vaccine?
Yes. So in Ghana, we are not giving pregnant.
Now, what we are doing now.
Okay.
But we've given pregnant women before.
Okay.
Yeah. In the past, I think since January.
Okay.
When we started it should be January last year. That's when the policy was revised to cover pregnant women.
Okay.
And their vaccine, the vaccine we reserved for them was Pfizer and Moderna.
Okay, but we don't have that currently in the system.
No.
Okay. So, well, if you're pregnant, you just may have to declare to the health.
You have to.
Yes, I mean, it's important. You may not be asked. Ideally, you should be. If someone is going to get a vaccine, you should ask these questions.
Oh, yes,
as a healthcare
of course.
provider.
It's very important to inquire about illness and whether the person is pregnant and so on. You need to. There are a few questions they ask.
Okay, so it's important just in case your healthcare provider or the nurse forgets to ask you. This is information that you must be willing to share. So, Doc, we're quickly wrapping up this conversation. Just to summarize all that we've said, even though the WHO says that we no longer have an emergency pandemic of COVID, it's recommending that we extend or try and cover a larger section of our population when it comes to vaccination, and you've explained why. So in just a minute, I'd like you to rehash those points just in case someone is joining us, after you made those statements.
Yeah, thank
Let's
you.
just explain why this is important for the WHO and the Ghana Health Service.
Thank you, Bennett. So what we have said is that on the 5th of May, WHO announced that COVID-19 is no longer a public health emergency of international concern. That does not mean that the pandemic is over, and that we are gradually moving from an emergency, or we've moved from an emergency and gradually heading towards what we call the integration. And therefore, we have risk groups, high risk, medium, and low. So our premium now will be on the high and the medium risk persons who would have to take the vaccine at scheduled times. And especially for the high risk groups, healthcare workers, the old adults, and adults with underlying conditions like diabetes, hypertension, and so on. We need to give them boosters, even if they have completed, as long as they've completed their primary series. And the boosters, the guidelines suggest that we give them 6 months to 12 months interval for the next couple of years. So the summary is that COVID is going down in terms of number of cases, but the disease is not yet gone. And we need to protect ourselves, especially the vulnerable, the most vulnerable.
Right. I appreciate your time here this morning.
Thank you very much for having me.
And that's Dr. Amponsa Achianu, Programs Manager, Expanded Program on Immunization at the Ghana Health Service. And so, just like we say, so if we want to deal with COVID, let's deal with it once and for all and not be relaxed because we think that we have overcome. That's the right thing. Thanks for correcting.
Thank you very much.
Thank you, Doc. Well, we'll be bringing you more here on the AM show. When we come back, I'll be joined by Mufasa. He's a finalist of Joy Prime's maiden edition of Cues and Lyrics, a musical reality show. You want to stay and listen.